Good evening and welcome to the Cancer Education Series brought to you by MercyOne and Above and Beyond Cancer. My name is Chris Goodale and I'm the Executive Director of Above and Beyond Cancer. We are brought to you tonight through a grant that we received from the Iowa Cancer Consortium. It's my pleasure, as it is every week, to introduce our founder, Dr. Richard Deming, who will introduce our speaker. Dr. Deming.
Great, thanks.
Dr. Deming, you're muted.
There we go. Thank you, Crystal. Wouldn't have a Zoom meeting if we don't start off muted. So thank you. It is my treat tonight, and it's going to be your treat as well, everyone, for to listen to my colleague, Crystal Tallman. Crystal is an oncology dietitian, and she's been at Mercy Cancer Center for over 12 years. We have shared the care of many, many patients. Crystal grew up in Illinois, and she came to Iowa to go to college and got both her bachelor's degree and her master's degree in dietetics at the Iowa State University. And she, as I said, is an oncology dietitian. In the world of cancer, dietitians play a huge role. It's not only in those patients who have difficulty eating, but in every patient, you know, we are what we eat. And there's such a huge connection between our nutrition and our health. So we bring dietitians on board for patients that are going through cancer treatment that might be having difficulty with nutrition and hydration, but also with anyone who wants to learn more about how to eat healthy and how to eat in such a way as to maintain great health. Crystal's topic tonight is Fear Not, Nutrition for Cancer Survivors. And without further ado, I'm going to turn it over to Crystal for her talk, and then I'll come back on and we'll do some questions and answers after her presentation. Crystal, thanks for being here tonight.
Thank you. Let's see, let's get this started here. All right, can you see my screen? Perfect. Okay, thanks. Thanks to all of you for coming tonight, especially those of you who are here in person. Considering it's the nicest night we've had in about 2 weeks with that sunshine and the warm temps. I appreciate you devoting your time to this presentation tonight. So like Dr. Deming said, I'm an oncology dietitian, and I primarily spend my time working with patients as they're undergoing their cancer treatments. I hear a lot of fears about nutrition, a lot of concerns, and I really want to focus my efforts on addressing those issues tonight as we go through this. So I'll be starting off the presentation with just laying the foundation of nutrition advice that we commonly hear that our patients are told, as well as what the normal healthy population should be, how they should be eating. We'll go through what's true or not, and then end up the presentation with recommendations on how to eat to reduce risk of cancer recurrence or to reduce the risk of a primary cancer. So I wanted to start this off with this image, and in my experience, when people are given a cancer diagnosis, everyone panics, and there's a lot of emotions swirling around it, and family and friends are called into action. They want to do whatever they can to help their loved one get through their cancer treatments. Since a lot of the medical management is kind of out of their control and they want to focus on what they can control, a lot of patients turn to their favorite tool for advice, the internet. We get a lot of patients who come in just having heard different things from their family or friends, some of which is helpful, some of which is not helpful at all, some of which is just plain wrong. And fortunately, this is rare, but sometimes that advice can be dangerous. So one thing that I really enjoy doing is when people have questions about what they've heard, about what they should, quote unquote, should be eating with a cancer diagnosis, I enjoy helping work them through that to see if it truly is recommended or if it really is just not true at all. So like I said, most of the work that Barb and I do is working with patients and helping with symptom management and side effect management as they go through treatments. We also both love hearing people kind of talk through the muddled mess of nutrition information to get through the internet and helping to bust myths. Ultimately, our goal is to, regardless of where they're at on their cancer journey, our goal is to help our patients make peace with food and using food to empower them on their journey. So this list on this slide is just a lot of the advice that our patients come to us having heard from their loved ones. They hear they should be eating organic foods, that they should be supplementing, they should be juicing. For breast cancer patients, some of them have heard they should be avoiding soy products, and they have concerns around that. Probably the most common one that we hear is that they should be avoiding sugar because sugar feeds cancer. We've heard that people should be eating asparagus, following a raw foods diet, detoxing. Again, some of these are pretty extreme, some are pretty benign, but this is just a smattering of some of the diet advice that our patients have heard. So I want you to think about just general recommendations you've heard for a healthy diet. And we're taking cancer off the table with this question, but I'm really just thinking about, for the healthy population, what types of dietary recommendations are made. We're told we should need to eat well-balanced diets, that we should enjoy everything in moderation and watch our portion sizes, that we should be eating at least 5 servings of fruits and vegetables per day, eating lean meats and choosing low-fat dairy products, that we should watch how much sugar we eat, that we should be eating show the diet advice that cancer patients are told, what we know about cancer diets, and if there's truth to that advice they're told, and then how that aligns with the general population diet recommendations. You might be surprised there is a lot of alignment in those. And spoiler alert, there's no true quote unquote cancer diet. It's going to be similar recommendations for anyone, regardless of what their health status is. So one thing that our cancer patients hear is that they should be eating organic produce. And I just want to take a step back for those of you who might not be familiar with what organic is. So organic produce is grown without the use of any pesticides. And so some people think that organic translates to a higher nutrient content and it's superior to conventionally grown. However, what studies have shown is that it's actually not, there isn't a real significant difference between conventionally grown and organically grown. The main difference is in antioxidant content. Organically grown does have a higher antioxidant content, so it'd be things like vitamin C, vitamin E. The reason for that is conventionally grown produce have pesticides to help protect them from bugs and other things ruining it, whereas organically grown produce that doesn't have that to protect it. So it has to basically build up its own armor against that, which would be antioxidants. So organically grown produce does have higher antioxidant content, but otherwise is fairly equivocal in terms of nutrients compared to conventionally grown. So if we look at cancer studies and we look at the connection between cancer and fruits and vegetables, what the studies just time and time again tell us is the most important piece is not how it's grown, but how much of it you consume. So most large-scale studies looking at fruits and vegetables have been done on conventionally grown produce, since that's what the majority of people eat. And what they've found is it doesn't matter if you do the conventionally grown or the organically grown, as long as you get it in. And if the harm of the pesticides outweighed the benefits of those foods, you wouldn't see consistent protective effects against cancer if you ate that conventionally grown. So moral of the story, just make sure you're getting fruits and vegetables in on a consistent basis. And I didn't put that in with the general population, but that is something obviously that's going to be important for them as well. The next thing that a lot of our patients hear is that they need to be supplementing. And I've heard people supplement. I'd say most people come in just taking fairly common supplements. They might be supplementing with a multivitamin, calcium, vitamin D are probably the norms that I hear. But I do hear others who do some less commonly consumed ones, turmeric, or I've had one patient who makes a tea and it takes hours to steep. So we hear a whole plethora of different supplements that people are led to believe will help them reduce either their tumor burden, make them feel better, or reduce the risk of other cancers. What the American Institute for Cancer Research, which looks at thousands of studies, has found is that we cannot be using supplements to help reduce our current cancer or to reduce the risk of future cancer. The most important part is making sure you're getting those nutrients that you'll be getting through supplement through your whole foods. However, there are a few specific cancer populations where supplementation might be beneficial, and that those are listed here. So the BC stands for breast cancer. About 75% of women with breast cancer have been found to have low levels of vitamin D. And we thought it's a chicken or an egg question. We don't know if the low levels of vitamin D increase the risk for developing breast cancer, or if it's that having breast cancer decreases the woman's vitamin D level. Regardless of the cause, vitamin D is something that we commonly encourage women to take. It's always recommended to try to get a baseline lab drawn, just so you have an idea of where you're starting at. However, in lieu of that, I'd recommend that people generally take about 1,000 to 2,000 IUs per day. That's a good kind of maintenance dose. Also, recognizing that women with breast cancer can be on therapies that affect their bone health, we also want to make sure they're supplementing with calcium as well. So depending on menopausal status, that would be about 1,000 to 1,200 milligrams of calcium per day. Postmenopausal women will need the lesser amount, the higher amount, the 1,200 milligrams. Premenopausal women need the 1,000 milligrams. The next one is colorectal cancer, the CRC. Studies have also found that vitamin D might be beneficial at reducing the risk of developing colorectal cancer along with calcium. The supplementation with calcium might potentially reduce the cell proliferation and promote cell differentiation, which is going to be advantageous for helping to keep that colorectal area healthy. And so vitamin D and calcium also might be things to consider supplementing with, or just making sure these patients are, or if you've got a strong family history of colorectal cancer, or you're just concerned about it, making sure that you're getting consistent amounts of dairy products in to hit your estimated needs for vitamin D and calcium. Prostate cancer is one type of cancer where we'd recommend limiting the amount of calcium intake. Studies have found that the more calcium a man tends to supplement with or consume via diet or both, it tends to increase the risk, have a higher association with a higher risk for developing prostate cancer. What that recommendation is that it should be a man should be supplementing with no more than 1,500 milligrams of calcium on a regular basis. So keeping under that, probably about 1,000 to 1,200 milligrams is going to be a safe recommended amount. And again, just not taking supplements for cancer prevention, no matter what the internet says, what your loved one says. If supplements were helpful at reducing cancer, they'd be used a lot more widespread. And recognizing that, if people are seeing ads or discussions on internet or on TV or even via family, that oftentimes there might be like a financial motive behind selling those. So just keeping that in mind when you're considering supplements, since they can be kind of pricey. So for the general population, I'd recommend that they consider vitamin and mineral supplementation after discussion with a doctor or dietitian to make sure that they are consuming adequate amounts and not overdoing it. Another common piece of advice that our cancer patients are told is that they should be juicing. I haven't heard this as much lately, but it is something that kind of crops up every now and again. Typical juicers, if you would just do standard juicing at your home, juices are going to pull out the juice from whatever fruit or vegetable you're putting in and kind of strip out the fiber and a lot of the nutrients. And it's going to be a very concentrated source of nutrients. What I would encourage people to do is just to make sure that if they do want to juice, that is not their sole source of getting their produce in, and that they're limiting their juice consumption to about 6 ounces or about 3/4 cup per day. There are a lot of varieties of juicing. Some people juice just fruits. Some people do fruits and vegetables. Some people do just vegetables. Some people do it in addition to our normal meals or kind of some more of a detox. From a detox perspective, the only thing juicing is found to do is to make you feel lousy because you're not getting enough nutrients in. So just making sure that, again, if you juice, it's in addition with your normal meals, you're getting enough protein in, and that it is not your sole source of produce. One other thing to keep in mind is that you want to juice the amount of normal fruits and vegetables that you would consume. So for example, it takes pounds of carrots to create a 6 to 8 ounce glass of carrot juice. Most people don't sit down to eat pounds of carrots at one time. So what you want to do is you want to only juice what you can feasibly eat, or what you would typically eat at a normal sitting. So it might look like part of a cucumber for someone, a little bit of broccoli, some spinach, some celery, and then like a little bit of like an apple or a pineapple to give it a little bit of sweetness to it, but just something that's more a reasonable amount. And realizing that especially fruits, once you kind of rip out the fiber and rip out the nutrients, it's a pretty concentrated source of sugar. And so it's going to be really helpful to have some of those vegetables in the juicing, so it's not going to be as high in sugar. From a cancer perspective, we do want to make sure that we are getting at least 7 to 9 servings of fruits and vegetables per day for women, 9 to 11 servings per day for males. That sounds like a lot, and it is a lot. One thing to keep in mind is that about 1 serving is roughly like the size of it, like a baseball, if you're talking about an orange or an apple or a pear. If you're talking about like lettuces, it can be 1 to 2 cups. And so it really isn't a lot of volume once you think about it. The important thing is just making sure that you're consistently getting fruits and vegetables in every single time you're eating. Because if you skip a meal or you skip a snack and don't get the fruit or vegetable, and it's going to be really hard to catch back up later on over the course of the day. So this is what we know for cancer. The general population, it is recommended to have at least 5 servings of fruits and vegetables per day. You might see this number increasing, but again, there is a big emphasis for fruits and vegetables for all populations. Some people are told to choose organic meats or dairy products to help reduce their consumption of hormones or antibiotics. And again, this is another thing that I tend to hear ebb and flow. I haven't heard it as much recently. Something to know is that hormones, so if by chance you happen to have hormones in your milk, which you shouldn't have that, but if you did, hormones are proteins, and it would be digested in your stomach just like any protein food you ate. So if you ate some fish or some cottage cheese or an egg, your body works to break that protein down. We do the same thing if you happen to consume hormones. So any hormones that you may have consumed via your dairy or meats would not necessarily alter your body's hormonal status because it's digested before that can happen. Some people get concerned about the consumption of regular dairy products and fear that there might be like antibiotics in milk, or I guess people are concerned they might get antibiotics in meats. Something to know about that is that let's say, for example, a cow is found to have some kind of illness that requires antibiotics. Antibiotics are used in these populations only when an animal is found to be sick, rather than just used as a general prevention method. When animals are found to require antibiotics, they're kind of pulled out of the normal healthy population, and their milk or their meat cannot be used. And so there's really not a financial incentive for farmers to utilize antibiotics if not necessary. So if choosing organic meats or dairy is something that is still something that's important to you, keeping in mind that organic meats and dairy do carry a higher price tag. One of the things we'll talk about later is the push toward a plant-based diet. And with the pricier price tag for the organic meats and dairy, that might automatically push you toward eating less meat, toward eating less dairy, and then just kind of push you naturally toward eating more plant foods, which again goes to kind of previous things and things we'll talk about a little bit more later. From a meat perspective, colorectal cancer has the highest associated with the consumption of red meat, increasing the risk for developing colorectal cancer. And where recommendations are is that people should limit their consumption to less than 18 ounces per week. put that in perspective, a 3 ounces is the size of a deck of cards, so eating no more than 6 of those over the course of a week. Keep in mind that red meat is beef, pork, and lamb. A lot of people forget that pork is actually technically a red meat, so factoring that into your consumption. It's also recommended to avoid processed meats, and this hurts a lot of people in Iowa, the Iowa community, because we have things like Bacon Fest and other bacon-geared events. But processed meats would be anything like bacon, sausage, pepperoni, lunch meats, and so recognizing that that for most people it's not feasible to completely avoid them, it's going to be recommended just to make it more of a treat rather than a normal intake, and really consume that sparingly. From the dairy perspective, again, from a colorectal cancer standpoint, consuming sufficient dairy has been found to be protective against colorectal cancer. And in ovarian cancer, the information is kind of up in the air. By that I mean, some studies have found that dairy might increase the risk, or higher calcium might increase the risk for developing ovarian cancer. Other studies have found that it could potentially decrease the risk. And so with the dairy status being kind of unknown, what I'd encourage women to do is to do no more than 2 to 3 servings of milk or dairy products per day, which is going to be the normal recommendation, and then making sure that they're choosing the lower fat dairy products, the skim or the 1%, just for heart health. The difficulty with doing ovarian cancer and diet studies is that kind of percentage-wise, there aren't a whole bunch of ovarian cancer patients, so it's really hard to tease out data to give solid nutrition information. So one of the most common things that I hear, I'm sure most of you have heard this to some extent, is that I have cancer. I need to avoid cancer because sugar feeds cancer. This is something I hear all the time, and I will go into depth with this in the next few slides. What we know from a cancer perspective is that it's okay to eat. We just want to make sure we limit it. And from the general population, it's the same line of thinking. The recommendations on your screen come from the American Heart Association. They're the only group that I know of that has made solid recommendations for how much sugar someone should consume. And that translates to 6 to 9 teaspoons of added sugar per day, which if you're looking at a food label, that ends up being 25 to 38 grams per day. Women should be on the lower side, men should be on the higher side. So to go more into depth for the myth that sugar feeds cancer, the theory behind it is that consuming dietary sugar will influence our blood sugar levels, will feed the cancer, and then cause that cancer to spread. The thought of it is partly based on PET scans, and I'm sure most of you have had a PET scan at one point. The rationale behind that is basically how PET scans function. So when someone gets a PET scan, they are injected with a radioactive glucose tracer. And cells that metabolize faster are going to take up more of that glucose tracer. Cancer cells metabolize faster than our normal healthy cells do, and which causes those cancer areas to light up like what you see on this picture. And so the thought is, well, if the cancer cell's taking up more sugar in this test, then I should limit the dietary sugar that I consume. Something that's important to keep in mind is that all cells, whether we're talking about our healthy cells or the cancer cells in our bodies, is that all cells function on glucose for energy, and we can't preferentially choose. So for example, we can't just consume a glass of juice or something and have it just diverted to the healthy cells. The cancer cells will take some up and the healthy cells will take some up. They kind of all utilize it very similarly. However, what's important to know is that giving more sugar to cancer doesn't cause it to grow, and depriving cancer cells of sugar doesn't slow their growth. So our brains function pretty much solely on glucose. And so if someone were to follow like a really strict ketogenic diet and they were to strip every carbohydrate out of their diet, get no sugar in, the brain functions on that. The brain needs that to keep working. And so what your body does is you can't outsmart it. Your body basically creates glucose from either the fat or protein that you consume or from your fat or protein stores. So there's still going to be some kind of inflection of sugar into your body. So we can't outsmart our bodies. But I don't want it to say that and give you a free reign, free pass to have however much sugar you want. That's not what I'm saying. It's still going to be important to limit the amount of simple sugar that you eat. So to give you a little bit more of a scientific explanation to that is that sugar and carb consumption leads to insulin release, and insulin tells cells to grow, including our cancer cells. So just to give you a little like biology lesson is whenever we consume carbohydrates or sugar, so whether we're talking about sugary things like ice cream or pastries or brownies, or we're talking about healthy carbs, things like fruits or vegetables or whole grains or dairy. Whenever we consume carbs, our body secretes a hormone called insulin. What insulin does is it basically pulls that sugar from our bloodstream where it can't be used into the cells where then it's utilized for energy. And insulin is like the key on the body's cell, or on the lock of the body's cell. It opens it up and allows that sugar to leave the bloodstream and go into the cell. What's important to know is that the amount of insulin our body produces is released proportionately to how much carb we eat. So to give the example of an apple versus applesauce versus apple juice, obviously the apple juice is the most processed of that, and so it's going to have the most concentrated sugar. The apple is going to have the most fiber, the most nutrients, and have the least amount of sugar out of those three things. And so we would expect that if someone were to eat those three things, that you're going to have a certain amount of insulin produced with the consumption of the apple, more produced with applesauce, and then even more produced with apple juice. And where there's a potential problem is if people are constantly pushing for an insulin release. And that would be in people who eat a pretty refined carb heavy diet and don't have a lot of balance. And so I give the example to my patients of if you're someone who eats, let's say you have an egg omelet for breakfast and a piece of fruit. And then for lunch, you might have something like half of a tuna sandwich with a bowl of black bean soup and a side salad. And then dinner might be something like a piece of grilled chicken breast and some broccoli and a glass of milk. So you have someone who eats like that. And let's say they do a dessert of some ice cream. So you have someone who does that. They're getting their treats in there. But you compare that to someone who has a very different diet, someone that's not well balanced and they don't have many other nutrients to it. So someone who might eat a diet of a donut with a juice for breakfast, and lunch might be something like a peanut butter and jelly sandwich with chips and a cookie and a pop. And then dinner might be something like pasta and garlic bread. Even though those people don't necessarily have treats in their diet, that person is going to have a lot more of an insulin production and insulin release than the previous diet that I recommended in the first diet. And so it's really looking at the context of the whole diet and making sure you've got your fiber in your diet, that you've got your protein and your fat, and that you are choosing, good nutrients in there. Eating a well-rounded diet is going to decrease that insulin production as best as possible. So I tell people, as long as you're eating a well-balanced diet, please get those treats in there, because treats are fun foods and we need to have those fun foods in our diet as well. But with the insulin telling cells to grow, if people are constantly having that insulin release and kind of pushing it, that's where there might be a potential risk for too much sugar causing a cancer growth. But again, you have to look at the context of the entire diet for that. Insulin resistance would be something like diabetes, where those tissues just don't respond to insulin, and more has to be pumped out for the cells to get the clue that they have to actually pull that sugar from the bloodstream into the cell. So insulin resistance and diabetes is being linked more and more with increasing risk for different types of cancers. The foods that seem to fight cancer best are carbs, fruits, vegetables, whole grains, and legumes and beans. And so when people tell me they want to follow like a ketogenic diet or a really low carb diet, but they want to reduce the risk of cancer, it makes me cringe, because we know study after study after study shows that the more healthy carbs you get into your diet, when you're getting them from these plant-based foods, the more that reduces your risk of cancer and kind of sets you up better for reducing your for preventing a primary cancer as well. So the important thing is just to make sure when you are when you are consuming carbs, to make sure you pair it with protein and or fat. So if you like to snack on, let's say, crackers, for example, have something like a Triscuit, which is a whole grain, maybe having some peanut butter or some cheese with it. If you're having fruit, maybe have some cottage cheese with it, just something to balance it out to help keep those insulin levels from spiking as high. Sorry, that was a long time spent on that, but I wanted to spend a lot of time on it because a lot of people have questions about that, and that's probably one of the most common fears that I hear. Detox is something else that some patients hear that they, quote unquote, should be doing. However, know that detoxing is unnecessary and potentially harmful. We have built-in detoxifiers in our body. Our kidneys and our liver, that's their functions, and they don't necessarily need any boost to help with that. The best thing that you can do is don't run a detox diet, nothing like that. Just make sure you're getting cruciferous vegetables in there. Those would be things like broccoli, cauliflower, Brussels sprouts, cabbage. They're getting plenty of that in there. They're getting plenty of fiber and plenty of water in as well. Cruciferous vegetables can actually help hasten the detoxification process, so they can help keep it moving. But again, it's in conjunction with the rest of your body, so it's not meant to take the place of anything. And the last thing that I want to address is, in regards to this, is women with estrogen receptor positive or ER positive breast cancers are oftentimes told they need to avoid soy. And if you've ever looked at a nutrition fact label, soy is in a lot of things. The reason for that is because soy is used as a filler, and it's kind of an emulsifier. It helps kind of hold things together in processed foods. So you'll see it a lot. What studies have found, and most studies are done in Asian cultures since soy is a predominant part of their diet, is that soy is actually protective when consumed in whole food form. So that would be things like tofu, edamame, miso, tempeh, soy nuts, soy milk. The consumption of that can actually be protective if patients are eating that in about 2 to 3 servings per day. Soy has actually been found to be the most beneficial in prepubescent girls before the breast tissue develops, including that soy in the diet can help reduce that risk of developing breast cancer. So if you have or have had a loved one with ER-positive breast cancer and they've been told to avoid soy, they don't have to read every single label looking for soy. That processed product is not going to have the isoflavones or that component, which might potentially increase the risk for the breast cancer. And I guess I forgot to say why there's that statement that soy can increase the risk for breast cancer. The reason for that is because soy is called a phytoestrogen, and phyto is plant, so a plant-based estrogen. And so when they hear that terminology, they're fearful that having plant-based estrogens in their diet will increase the risk or increase their body's estrogen. However, and then eventually fuel their cancer. However, soy has such like thousands of times weaker than our normal estrogen that it would not have an impact upon a woman's breast cancer status. So again, feel free to consume that if it's something you like, and if you don't like it, don't worry about it. So I'm going to be switching gears here and kind of getting into other things that you can do to help reduce the risk of recurrence. So I think it's important to bring to light that 1/3 of the most common cancers can be prevented through diet, weight management, and physical activity. So we truly do have a lot of power in our hands in terms of lifestyle approaches to help reduce our risk of developing these. This is just another look at that, and just wanted to point out that behind smoking, being overweight or obese is going to be the second highest risk factor for developing cancers. So that's going to be a big part of living healthy. One thing that I'll be addressing kind of in the next slide, but I wanted to start with it here, is that the American Institute for Cancer Research put out, based on thousands of studies, they put out 10 recommendations of what we can do to help reduce our risk for developing cancers. And so that's on the next slide, and I want to go through those. But I also wanted to bring this to light to focus on the forest, not the trees. I have a lot of patients after they finish treatments, they're done seeing us as often, and they're kind of cast off into the world. they don't know what to do. They don't know how to eat. They're fearful of eating in fear that they're going to eat something quote unquote wrong that's going to fuel their cancer's growth. What I want to highlight is just to look at the big picture. Again, American Institute for Cancer Research put out 10 things that we can do. If people are meeting all 10 of those things, then I would have them kind of dig into the minutia of other things. I might have patients who really want to focus on certain supplements, which again haven't been found to help reduce cancer risk. Or they're just looking at other kind of nitpicky things that in the big picture are not going to be advantageous from a cancer perspective. So we really want to look at the big picture and make sure that your overall health needs are being taken care of. So this is going to be what AICR put together. And again, this is based off of thousands of studies put together by an expert panel. And so I know y'all can read, but I just want to go through these, that the 10 recommendations for cancer prevention are to be at a healthy weight, be physically active, limit your consumption of sugar-sweetened beverages, don't use supplements for cancer prevention, limit how much alcohol you consume, limit the consumption of red and processed meats, making sure you're eating a diet rich in plant foods, limit consumption of fast foods and other highly processed foods. And then after a cancer diagnosis, follow these recommendations as best you can, recognizing that sometimes it just takes people a while to recover from their cancer treatments and they can't always follow these, but this might be a good kind of long-term goal to be shooting for. And then for women who might be pregnant or might be lactating, breastfeed your babies if you can. All of those are found as just general recommendations. So when people ask me what they should be eating for their cancer type, I always start with if there's any specific dietary recommendations related to the type of cancer they've had, and then follow it up with these recommendations on your screen. So Barb's my colleague at our West office, we don't recommend diets. What we do recommend is going to be kind of frameworks that have a lot of data behind them, and one of which is the Mediterranean diet. So when I think of diet, when limited in time and is not necessarily a lifelong dietary approach. So when I think of diets, that's where my mind goes. However, the Mediterranean diet is going to be something completely different, and it's got years, decades of good support behind the efficacy and the healthfulness of it. So the Mediterranean diet is not necessarily one specific diet. It is just kind of a compilation of how the countries surrounding the Mediterranean Sea, how those people tend to eat. And so you can see, I know this picture isn't very big, but on the bottom, you can see that there is an emphasis on being physically active and actually sharing meals with family, not eating alone in your car on the way to soccer practice. That on the next one up, making sure you're getting lots of fruits and vegetables, whole grains, and healthy fats, things like olive oils and nuts, getting herbs and spices in your diet to help flavor versus adding salt in. Making sure that fish and seafood are in there regularly, weekly. Poultry, eggs, cheese, and yogurt, so basically dairy, is consumed moderately, daily to weekly. And on the very top is the meats and sweets, and that's kind of less often. Some of you might appreciate that the Mediterranean diet does include wine, red wine in moderation in it. And this is just kind of a healthy lifestyle that we would recommend. It's very much a plant-based diet, which very, very well aligns with cancer recommendations. So when I use the term plant-based diet, I always tell people that's not necessarily synonymous with vegetarianism. Plant-based just means that the focus of your plate is going to be fruits, vegetables, and whole grains. So whether we're talking about a meal or a snack, about 3/4 of that plate should be a fruit, vegetable, or whole grain, and that other quarter be your protein. So whether you choose it to be an animal protein, like a chicken, fish, beef, pork, whatever, or you choose it to be a plant-based protein, like a bean or lentils, quinoa, something like that. We just want to make sure that the emphasis is going to be your plants and that the accent is going to be your protein option. Now, I will take a step back. This might not be entirely appropriate for patients undergoing treatment, since as you go through treatments, you do need a higher amount of protein to aid in healing, but definitely after treatment, after those side effects have cleared, this is going to be the emphasis to push toward. So people wonder, well, why do I need to eat so many plants? You're telling me I need to eat, 7 to 9 or 9 to 11 servings of fruits and vegetables per day. Why? The reason for that is because on the screen it lists all the things that plants can do to help protect us from a cancer standpoint. All of these things can happen with different colored fruits and vegetables. So that's why it's so important to quote unquote eat the rainbow, making sure you're getting a good variety of different colored fruits and vegetables in to help you meet your needs. So for people who don't like plants, and I do hear a lot of that, people who are meat and potatoes, grew up on a farm, they just weren't exposed as a kid, they just don't like them, whatever the reason may be. I always tell people to build their intake slowly. That might be something like, if you're used to eating cheeseburger, can you add a slice of tomato to it, or a slice of lettuce? If you are someone who eats, if you like oatmeal, can you add berries to it? Can you add some walnuts to it? Can you add a banana to it? Kind of melting pot type foods, so things like stews and soups and stir fries and omelets, casseroles, all can be great ways to slowly start incorporating more vegetables. And especially if you've got like, the broth or the gravy or whatever, kind of masking the taste of the vegetable, that might be a little bit easier for some people to incorporate. So always work it in slowly, and then as your taste buds start to acclimate, just keep increasing the amount of those plant foods that you get in. Experiment with different preparation methods. You might be someone who absolutely hates raw carrots, so you don't ever eat carrots. Well, have you tried roasting them? Have you tried steaming them? And adding a little bit of Parmesan, a little bit of olive oil. Sometimes that preparation method just makes all the difference. I really like roasting. This isn't a great time of the year. Grilling would obviously be a little bit more appropriate this time of year. But roasting and grilling can really take away some of the bitterness of some of those vegetables and make them a lot kind of sweeter and more palatable for a lot of people. So that can be a great option. And then just challenging yourself to try something new. And I'd say this goes for people who are great fruit and vegetable eaters. There's probably always something else you can try, as well as people who aren't used to eating them and are really working on incorporating it into their diet. Just, set a goal of, once a week, you're going to try to add one more thing in, or one new dish where you add a little bit of fruit or vegetable in, just being creative. So this is a great resource here, is the World Cancer Research Fund Continuous Update Project. And this continuous update project is every few years updating the knowledge behind different cancers and their associations with diet. So it has most solid tumors in there. Some of the rarer ones it does not, but most of the common ones it would have some kind of data or some kind of association listed on this website. And so from that information, these next few slides are going to be actually cancer-specific recommendations. And these are going to be the cancers that have the most data supporting them. So whether you've had these types of cancers and you want to reduce your risk of recurrence, or if you just want to know kind of what other populations are looking at or ways that you can reduce your risk of getting these other types of cancers, these are some things you can try. So breast cancer has quite a bit of an association with diet. Being overweight or obese is going to be one of the bigger risk factors for breast cancer. So maintaining a healthy weight is important. Being physically active, and I'd say end goal would be at least 30 minutes, 5 days a week. But if you are someone who never exercises, even just setting a goal of 5 minutes a day, 10 minutes a day, and slowly working yourself up. Eating cruciferous vegetables, again, they help with that detoxification process we talked about earlier. Any method you can get them in, so whether you like them raw, steamed, cooked, stir-fried, however you get them in is going to be helpful. Again, the cruciferous vegetables are the broccoli, cauliflower, Brussels sprouts, cabbages, any of those headed type vegetables. What I suggest, especially from a breast cancer perspective, is trying to get a serving in about 1 or 2 days a week, every couple of days at a minimum. And I would try to get them more often if you possibly can. Avoiding or limiting alcohol, and I always tell people this, but I realize that alcohol has more of a social component than other types of foods. And sometimes with like a family history of heart risk, some people want to do red wine for that. So I just kind of lay the information out there for people and then let them do with it what they want. But studies have found that the more alcohol a woman drinks, the more it increases her risk for breast cancer. So from a breast cancer perspective, it's best to abstain from alcohol. There's no like quote unquote safe amount of alcohol to be consuming. But if you are someone who wants to consume it, just do it in moderation and just be aware that that is something that you want to keep in mind. For women who have a diagnosis of a triple negative breast cancer, they would want to consume less than 20% of their calories from fat. And studies have found that can actually have, I think, a 30 to 40% risk reduction of developing recurrence if they do that, plus the other lifestyle components. So with triple negative breast cancer, they tend to have fewer treatment options, but lifestyle approaches tend to have more bearing on this population than the other populations of breast cancer patients. Prostate cancer, maintaining a healthy weight is also important for this population since it can be hormonally driven, and hormones are stored in fat stores. So if we lose weight, we reduce our hormone load. Including soy in the diet can be helpful. Limiting calcium intake again to 1,500 milligrams per day. Just for a point of reference, a cup of milk and a cup of yogurt has about 300 milligrams. So if you're someone who likes milk, just make sure you're not doing more than 5 cups a day, which I have had people do far more than that. So just keep that in mind. And incorporating lycopene into your diet. Lycopene is a nutrient found in tomato products. And it's going to be in things like ketchup, tomato sauces, tomatoes, any type of tomato product. Lycopene is more available to your body once it's cooked. And so it's actually recommended to have it in things like spaghetti sauces or to cook tomatoes, just to make that lycopene more bioavailable. And then consuming sufficient selenium. Selenium is a mineral. It's found in dirt, actually. And so the contents, and so it's found in dirt, but then it obviously goes to the fruits and the vegetables that dirt is grown in, or excuse me, that those plants are grown in. And so selenium contents can be highly variable based on the selenium content of the soil that those foods are grown in. And so there's not a great recommendation for how much to be getting in. One really good source of selenium is actually Brazil nuts, those really big honker nuts. You only need to eat like 1 or 2 of those per day, and that hits your selenium needs for the day. So if you're someone who likes Brazil nuts, that's a good way to get that in. For colorectal cancer, again, maintaining a healthy weight, drinking alcohol in moderation, so not going over the 1 to 2 cups per day, or servings per day. Limiting the red meat to 18 ounces per week or less, like we talked about earlier, avoiding processed meats, being physically active, and consuming whole grains. Studies have found that people who have a higher fiber diet have a lower risk of colorectal cancer because it keeps things moving through. It doesn't allow those carcinogens to sit in the colorectal area. It gets those carcinogens or toxins moving through the body and excreted faster. The 25 to 35 grams per day, women should be on the lower end of that, and then on the higher end. And then again, the consuming adequate calcium that we addressed earlier. So just to kind of wrap things up, like I said, one thing that I really enjoy doing is to help people dig into their emotions around foods, realizing that food is a joy, it's a treat, it's delicious, it should make us happy, it's social, it has an influence upon our health. There's a lot of benefits to foods, but most people tend to focus on the negative emotions of foods. They're fearful that it's going to increase their cancer risk. They're fearful that it's going to increase their weight. They're fearful they just don't know how to act around it. And so what I like to help people do is to help entangle those fears and try to get to kind of their emotions associated with eating, because a lot of work I do is just more behavior modification. It's not necessarily that people don't have that knowledge they need. It's more of they just don't have the skill set to make those dietary changes because they don't have their mind is in the right place, just because we're so ingrained with dietary habits over the course of our lifetime. So I really like to help people, help them bring peace with their food. And so to leave you with that today, the first thing that I encourage you doing is just confront fears you might have about food. What fears do you have? Why do you have them? What role do those fears play in the foods that you choose to eat or that you choose to avoid? Say goodbye to the food police. There's no good foods. There's no bad foods. You don't need an inner voice telling you, shaking its finger at you when you're eating something you quote unquote shouldn't be eating, or congratulating you if you only eat 600 calories in a day. That's not healthy and that's not good for you. You really want to get to a point where there's not that judgment on what you're eating, and just realize that food is food. Food is to nourish us. Food is for pleasure. And that's it. And really just taking that control from food and giving it back to ourselves. Some foods, so choose foods for your health benefits. Some foods contribute to a healthier body than others. Focus on the foods that provide you with good nutrition, help keep you strong, help keep you growing well. Have that be about 90% of the calories you consume, but make sure to keep fun foods in your diet, and kind of round that out with that last 10% of calories should be coming from fun foods. Quality over quantity is important in many facets of life, with food being one of them. So eat good quality food. So one guaranteed way to get yourself to eat something that you quote unquote don't want to eat is by telling yourself that you can't have it. So don't tell yourself that. Just banish those forbidden foods and just realize that every food is on the table. Every food is an optional for you. And it's just a matter about the portion control. And lastly, just wrap up with listen to your body. Too often in our fast-paced society, we are just taught to not listen to our body. We don't know what food tastes like. We don't know how our body feels when we're hungry. We don't know how our body feels when we're full, because we're taught to drown it out, because there's constant distractions. We're eating when we're driving. We're eating when we're watching TV or working on the computer, or skipping lunch to eat or skipping like a set aside lunch to eat lunch at our desk. We really just want to slow down, listen to our bodies, take time with eating, enjoy the food, pay attention to the signals your body's telling you, and give yourself permission to stop when you're hungry, stop when you're full, and then start eating again when you're hungry. And it's just amazing when you see people actually make that connection after years or decades of being fearful of food. So with that, I will kind of wrap things up and kind of open it up for questions.
Great. Thanks, Crystal. Hey, Crystal, would you mind stop sharing, and we will then, let me bring both of us up on the screen together. There we go. Great. What a great talk. So informative. I love the way that you said from the outset that, there's not really a cancer diet and a heart diet and a diabetes diet and a anti-stroke diet, that it's really a good, healthy diet that really helps reduce the risk for a lot of diseases. I would say that most of us would probably score really well on the written test on what to eat and what not to eat and how to eat, but we don't always do so well on the practical test. And you talked about behavior modification. What are some of the ways that those of us who kind of know, and you've reinforced our knowledge, can actually score better on the practical test? Certainly, if I was eating with you every day for all 3 meals, I probably would behave and do better on the practical test. What are some of the ways that individuals who know what they should do but get distracted and eat in mindless ways instead of mindful ways, how can they do better with accomplishing their goals?
Yeah, no, that's a great question. First and foremost, I always encourage people to meal plan. It's an understated advantage when you're trying to eat well, where you just kind of lay out your meal plan for the week, and you can kind of factor in, are you going to be gone for baseball games? Are you going to be eating out certain days, where you can just plan your entree and then work your sides in, and that will help set up your grocery list, which can make sure that you're guaranteeing you're getting those healthy foods in. So I think meal planning is a very important part of it. Another part of it is just, like you said, kind of slowing down and just trying to remove distractions. And it is super hard to do, but it's really important to do. And so when I work with people, again, a lot of it is just, you need to just stop your distractions. And it's not something I'd expect to happen all of the time, like forever and, until the end of your life, but just something where for a week or two, you're really just paying attention to your eating. You are turning off the TV, you are turning off, you're not scrolling on your phone, you're not working, and you're just listening to your body. And you do like in, clinic, we do the pain scale. We do the same thing with the hunger scale. So kind of assess how hungry you are before a meal, touch base with your body in the middle of the meal, and then after the meal. And just kind of remembering and kind of feeling those sensations that is so often suppressed. So I think that's a big part of it. And intuitive eating. And again, I think a lot of it is just working with someone who can help you work through the mental component of it. So whether it's like a dietitian or a therapist, there is so much mental component to eating. You're right. It's not a lack of knowledge. It's just more of how do we retrain our thinking. And sometimes people need more professional help with that. I'm trying to think what else I tend to recommend to people. Having a great support system is going to be helpful. Tracking intake in a food journal, and just having some kind of accountability, especially if you live alone or maybe don't have someone to keep you accountable in your home, where you have some kind of built-in accountability to yourself, I think is all helpful.
Yeah, that accountability and, a buddy system. And I would imagine there's apps today too that can help, where you're sort of accountable, you record things, which is one way of, reminding yourself, and create even an online support group to encourage each other to eat healthy. Well, this has been great. Thanks for all of the information. Our patients benefit so much by having you present in our clinic, and I know that you're available for cancer survivors and patients. So Crystal can be reached at Mercy Cancer Center, and she and our other dietitian, Barb, just love to provide assistance and help to all of you. So thanks for being with us this evening, and I'm going to turn it back over to Chris. I'm going to mute myself, and he's going to take us out. Thanks, Crystal.
Thank you so much.
Crystal, thank you. Very informative. And this can be seen, as all of our cancer education series sessions can be seen on our YouTube page for Above and Beyond Cancer. Just go to YouTube and search for Above and Beyond Cancer. And also on the MercyOne website. If you go to the MercyOne website, you can just search for Cancer Education Series. So we really appreciate you spending time with us tonight. Great advice and some simple things that can really help us be much healthier. So Crystal, thank you. Take care, everyone.